Hi friends, hope you're doing well. I'm Dr.Milind, MD Pediatric from IIMS Bhopal. So today we'll talk about preparing for INI CET. A lot of students have been asking about what should be like, what else should I do with, because I'm preparing for NEET PG as well. So what extra I should do to prepare for NEET PG. So today for INI CET, so today in brief, we will just talk about what should be your different approach, what extra things you need to do to prepare for INI CET. NICT is not a completely different exam. Just is needs a particular focus and some few things. I'll say it's 90% similar preparation, just 10% extra things that you need to add. It's about the subject distribution and the way you attempt the exam. So we will first talk about this NICT. First, let me talk to those students who are thinking and worried and who are not sure whether November INI will happen, because in comment section I get a lot of questions about whether November INI will happen or not. So let me show you the notification on the AIMS academic tab that is under the key dates section. So you can see INI CET PG for January 2023 session. The dates they have already given. So it will be there for 100%. Even the dates are there. So exam will be on the 13th of November, that is Sunday. And the result will come out on 19th of November. They have not released the date of counseling, but the exam date they have given. So it is going to be there. So don't worry. So if you are someone who are targeting INI completely and wants to take extra chance for INI and wondering whether November session will be there or not, so it's a good news for you. You can solely focus on INI, and there are two good chances on offer. One is on 8th of May and another is on 30th of November. So why INI set is different? Why going into AMC becomes so important for some students? So what I will relate to the students, because it's sometimes it just you have to for me it was like I had to prove myself. That is the reason I chose AIMS, and I left my NEET PG seat and I joined AIMS, because it doesn't matter. Like sometimes Supreme Court had said once about these institutes, IITs and AIMS. As I always say, that institute is not something that makes the student great, but the student that make the institute great. INA has a different kind of competition. It's not necessarily that if you get a good rank in INA, you'll get a similar rank in NEET. So there is always a different, but sometimes it's the mark of your ability when you go through INA. So that makes INA city more desirable among few students. So let's start the discussion about what additional need to be done for INA. That what extra you need to do for INA. Similarly, as I said, I had rank 125 in AIMS, but I had around 2700 rank in NEET. I had also seen a lot of students. One of my friend had rank 36 in AIMS, but his NEET rank was somewhere 3000. So it's always like the students who get very good, like higher ranks about within 200 in NEET, they don't get like similar kind of 1 or 2 digit rank in NEET, or even 3 digit, because there are things that set INI and NEET differently. So what additional need to be do for INI? If you're someone who wants to just target INI, who wants to go for going to crack INI exam. So as you know that INI now has AIMS, Chipmer, NEMHAS, and PGI. So PGI is to have multiple choice questions, but now that number of questions have decreased. So what INI has most importantly is that you should have a command on basic sciences. So your maximum questions will be from basic sciences. What happens for medicine, for NEET, your medicine become important, your surgery becomes important, your PSM becomes important. These are like, as I call them, rank maintaining subject for that. But for suddenly for INI, as it was said in November session, who wrote last INI, they said there were hardly any question from medicine, because they want to check how ready you are for how good you are with your basic sciences, because that is going to form the foundation of your course. Second is clinical based practice. So a lot of questions AIMS ask very simple questions, like they were the ones who started showing the pictures of cannulas in YouTube, and very simple clinical things that are used during your clinical posting, and also like regularly used there. These questions are asked. Now there are so many things. So how can you improve? Like you said that AIMS has a very clinical based scenario. Also, you need to correlate a lot of things. AIMS, these INI questions, most of the times they are very simple questions asked in a twisted way. So how can something that help you is discussion with your friends. So if you discuss with your friends, this can help you. If you are going to discuss with your friends certain concepts, certain topics, so you are going to discuss all part of it. So I think this is something that helped me, and a lot of students was discussing with the friends. Then one of the most important point is previously asked questions. So previous year questions are the most one of the most important limb of preparation for INI. So as INI has just started like 3-4 sessions back. Before that, it was AIMS and JIPMER different. So I'll advise you can at least do last 3 years question at least, but ideally is last 5 years, because a lot of JIPMER questions are asked in AIMS, a lot of AIMS questions are asked in JIPMER, but now they have combined. So a lot of new drugs, new concept that JIPMER has already asked like 2 years back, they might be asked again in some other aspect. So when you read that question, you read the related explanation, you cover that area. So these questions become very important. So if you have not, if your target is INI, if you want a good rank in INI, you should definitely do PYQs. Then first aid. I had already released a very detailed video about first aid and how to get benefited from first aid, how it is you what should be your approach to the first and how to read it. This is something because first aid is a high yield book and it is basically most of the basic sciences things are there. But what I'll say for INI, read basic sciences from first aid and see all the images, charts, and graph from clinical side. That is, a lot of pathological images are there in first aid. A lot of graphs are there. Lot of clinical images, X-rays, and radionuclear nuclear these studies are there. A lot of these related images are there. So you can get the idea of these images from first aid. Now this is the preparation. So as I say that whenever you attempt INI, 60% is your preparation, but 40% is how you write the exam, because you have to be very alert when you answer the question, especially for INI, because there will always be some twist, as I said. So you have to read question with alert mind, even no matter how simple the question looks. If you feel like this is very simple, this looks like a full toss, but don't get out on full toss, because AIMS questions are different. Even they appear simple, they have some trick in it. And attempt maximum, as I said, that around out of 200 questions you have to attempt more than 190 if you have to be in the competition. Even I attempted 196. Lot of toppers whom I have who were my inspiration that time, and even my juniors who got very good rank, everyone attempts more than 190. So you should attempt more than 190 if you want to get a good rank in INI. So guys, that's all I wanted to say, that there are not a lot of things you have to do differently for INI. You should have, as I said, that take home messages, basic sciences, PYQs, and attempting an exam well. So this is something that is going to set your good rank for INI. So I wish you all the best. If you have any doubt, let me know in the comment box, and take care.